Sue, good morning.
Good morning.
We talked a little bit about HIPAA requirements and the fact that this is going to be used for educational purposes and shown to other people. Is that okay with you?
That's fine.
We do that?
Mm-hmm.
Okay. We want to spend a few minutes just talking about what we've done over the course of the last probably almost a year, been 9 months.
Yep.
And you came in, you had a lot of pain going on, didn't know what it was caused from and what was going on with the pain. And you'd seen neurology in the spine center and nobody could track it down.
Correct.
Okay, why don't you tell us a little bit about your history and a little bit about what we've done and where we're at today.
Okay. I had presented to my family physician in September of last year, September of '07. I had had a few years where I was experiencing some pain up in the left occipital area, occurring very randomly a couple times a year, lasting an hour or two. Thought it was mainly just a positional problem when I slept. But come September, I started to get these pains about 2-3 times a week. Always woke me up between 3 and 5 in the morning, last an hour or two. Getting pretty moderate in pain scale. When I come see my family doctor, I could not reproduce the pain. Weren't sure what was going on, so we started with an MRI. They did a head MRI, which did show a meningioma. Doubtful that was causing the pain, they sent me to neurology for further evaluation. I went to neurology. They then proceeded with an MRA, hoping to find some type of occlusive thing going on that was causing my pain. That showed up negative. They did recommend a couple medications, Indocin, Maxalt, to take at the onset of the pain, see if it would help. It didn't do anything. So from there, they sent me to the headache clinic. I was evaluated in the headache clinic, and they too felt this was not a migraine, nor a variant of a migraine, but they thought the best thing that would help me would be some nortriptyline. Very leery of taking medications, I declined, and wondering where can I go from here, so they forwarded me on to the spine center. By the time I got to the spine center, this is December, so I started out in September. 2 months had gone by. My pain had now exacerbated to 4 or 5 times a week, occurring during the day. Not only was I getting the occipital pain, I now had pain in my neck, down into my shoulder.
Now we had talked a little bit about a pain gradient, 0 to 10.
Oh, these
where was
pains were getting to a 10.
They were.
They were getting to a 10, and they were lasting 4 or 5 hours. Motrin didn't touch it. That was about all I had for pain medicine, but nothing would happen. But my shoulder pain was starting to get to the point where I couldn't raise my arm up over my head. Taking clothing off was an issue. Putting a coat on, reaching for an item was painful. I was also experiencing in the nighttime, my fingers were falling asleep. I'd wake up, numb hands. My right shoulder was hurting. I was getting pain in my right side of my face. So when I saw the spine center, they then proceeded with an evaluation that included an MRI of my cervical spine, shoulder x-rays. They sent me on to physical therapy and occupational therapy. So from there, physical therapy gave me stretching exercises. They gave me posturing changes. They tried a TENS unit that they would attach these electrodes to my neck. None of that, which helped.
Didn't help at all?
Didn't do a thing.
Okay.
Didn't do a thing. What else did we try? Occupational therapy gave me different positions to sleep at night. I had already gone through a couple different pillows, but none of that seemed to matter. So then I came back to the spine center, and at that time, it was mentioned, do you have TMJ? I don't know. I don't know what TMJ was at the time. So grasping onto that straw, I was going to move forth with figuring out what is TMJ. In the meantime, my pain was so severe that they did send me on to get a trigger point pain injection. So they took some cortisone, injected it in the back of my head at a trigger point area. I got a good 6 hours of pain relief. After that wore off, the pain started coming back, and within 2 days I was back to where I started.
Okay.
Desperate, so to speak, to get rid of the pain and not want medication and trying to figure out what's happening with my body, I looked into the Mayo Clinic dental office. They do have someone there that does work with TMJ. However, their process, now this is the end of December, the process that was explained to me is by the time they would look at my records, deem that I could get an appointment, I was looking at the end of February.
Okay.
I also then looked outside Mayo Clinic, got a hold of a very good friend of mine who then recommended you.
Okay.
So I came here in January, as you remember, a little skeptical, not sure if you were going to be able to help me, if this was my problem, but hey, it's worth a shot.
Right.
So you did the mouth impressions, and then when I came back, you were able to show me how my bite was. But I have to say that during that appointment, when we were doing molds and whatnot,
Right.
it was the only time anyone could ever reproduce my pain.
Okay. That's interesting.
So I was very, very hopeful that this was my problem. Because I suffered pain, but it's the only time I wanted the pain.
Right.
Was knowing, hey, what you did to adjust, manipulate my mouth for examination is what triggered my pain.
Okay.
So then I came back, and we then started with the mouth guard.
Right.
The mouth guard you put in, golly, it took about 2 days before it felt comfortable, but I was able to talk. I didn't want to eat with it in, so I'd only take it out to eat, but it was actually became more of a comfort. It was I needed that in to feel comfortable with my mouth.
And when that was in, what'd your bite feel like?
All my teeth all touched.
Okay.
It was like I never realized that I was struggling to try and get my back teeth to touch. I had always been a gum chewer and always would place my gum, and when I was told not to chew gum anymore, I found that I was pushing my tongue back there.
Putting your tongue in between your teeth?
Yeah, in the back of my teeth
Okay.
for comfort. And I guess all that was done without me realizing it.
Because you were noticing just your front teeth were touching,
Yep.
not your
Yep.
back teeth?
And when you showed me my model
Okay.
of how my bite went, you could see clearly that everything was coming forward and I wasn't getting any touching in the back of my teeth.
Okay.
So we would put the mouth guard in, and it was amazing to me. You would have to come back multiple times
Right.
for minor adjustments, but all it would take was one of your adjustments and my teeth fit again.
Yeah.
But it would amaze me how I could feel my teeth touching and how they were supposed to be, and after a couple of days, there must have been so much movement in my jaw that all of a sudden I'd feel that everything wanted to come forward again. So we'd come here, do some adjustments, my bite would fit again, and we did that multiple visits for about 6 weeks. But my head pain, the severe pain I was getting, subsided within 3 weeks.
Okay.
I no longer got that pain. I could sleep at night. I wasn't getting any pain during the day.
You'd raise your arms up.
That took about 6 weeks,
Okay.
because we started in January. By March 1st, I had no shoulder pain. My fingers weren't falling asleep.
Okay.
I was ecstatic.
Right.
But I can tell you, had I not seen you, I think that I would have been deemed a chronic pain, fibromyalgia type pain person on multiple medications,
Right.
continuing with physical therapy. I don't know, I assume that's where I would end up.
Yeah.
By the time I came here, I had 6 diagnoses of pain.
Okay.
3 weeks after seeing you, 6 weeks into the process, I have no pain.
And you haven't had any pain since, other
No.
than,
The only time I had pain is now we're trying to adjust my mouth
right.
without wearing the mouth guard during the day. And going through that, never to a severity of 10, but I would know you start to recognize pain signals, and then I would come for an adjustment or put my mouth guard in, and that takes care of the pain.
Right. And we put that in January,
Started in January.
and you were basically out of pain at the end of March.
Yeah, mid-March.
And then you wore that for 4 more months
Correct.
before you would let me do anything to your teeth.
Yes.
You were pretty skeptical and you were comfortable. I mean, you didn't have pain.
And it's still my comfort piece.
Yeah.
Still my comfort piece. I still don't let it leave my purse or go anywhere without it. I wear it religiously every night, most
Wearing it at night.
evenings. I'm getting to the point where I'm comfortable during the day now, or I can wear it during the day hours, but
And when we were doing the splint therapy, you were wearing that 24/7, right?
Oh, yes.
Except to eat
Just to
and
eat.
brush your teeth.
And it would go right back in.
Okay. And then what did we do at the end of the summer, the end of the 4 months, when you were comfortable and you finally wanted your bite to feel like that?
Yeah, so in July, end of July, I decided to come back and say, okay, now what do we do? Then we took the mouth guard out. We did your equilibrations again, see where is my bite, and you just started working on my teeth, which you hear someone's going to grind onto your teeth. It makes you a little nervous, but
Right.
it's painless. It
Yeah.
is painless. And it's amazing, just little adjustments that you make, how I can bite down and go, oh, it's like having my mouth guard in.
Yeah,
But again, I've had to come multiple times, and I think it's still a process.
right,
But it's a process that you can't just put a mouth guard in and leave it.
right.
It doesn't work.
It's gotta be
You gotta keep
adjusted
coming
regularly.
back, correct. And coming back
Yeah.
takes 10 minutes of your time, quick little fix, and it's amazing how it goes right back to where it's supposed to be.
So now you're not wearing it at all during the day? Just wear it at night?
Yeah. I do put it in some evenings, just more of, I think, a comfort for me that I'm afraid something's gonna happen, but,
Right.
and I wear it all night.
Okay,
But take it out in the morning, and
Yeah.
so far, good to go during the day.
good. All right, well, this is something that's turned out very well for you.
Well, I hope that there's, that there gotta be other people out there that are in pain, fibromyalgia type pain. I happen to fall upon you.
Right.
I don't know how else to say, but I think it was luck. But if there's other people out there, when you start having all this pain, obviously physical therapy, medicine is an okay way, but if
Right.
it's your mouth and this fixes it, I'm happy.
Pretty neat.
It is, yeah. So if there's other people out there like me, I hope they're identified.
Good. Well, I appreciate your interview.
Yes.
Sue, and spending some time talking to us.
Thank you.
You're welcome.